Good morning. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to talk to you a little bit this morning about reducing the overjet and the overbite in a severe Class 2 Division 1 case. And this is about as bad as I've seen in Class 2 cases where the upper teeth are so far out in front of the lower teeth. But it worked out quite well, and I've taken this in the series as a kind of we jump back and forth in here. It may be a little confusing to you, but we'll show you what we did and kind of how we did it. So thank you very much for watching, and I hope you enjoy this case. I'll have to start off here. This is the way we started with the young lady. This is back in, I think, took about a couple of years, or not quite that much. And this is after we finished with her. We got her teeth up. You can't see the difference in it in that particular picture, but here is the cephalometrics on it, and actually she closed further back than this, which we will show in a little bit. And then we brought this up to the anterior part where the overjet and overbite was pretty much normal. And you can see here later on how it finished up with the case. And this is just another cephalometric of it. And this was 4/28/11, I think, when we started. Now here's the model case, the models of the case. And this is the overjet. This is about as bad as any Class 2 Division 1 I've ever done. It looks like it's about 12 millimeters or more, and overjet. And the overbite is not all that bad. Something like that where the lower teeth are fitting up above like that. Anyway, looking from the inside of the model now, you can see the lower teeth actually came up here, and so the bite closure, in other words, this went up high, so you're going to have to bring these teeth down in doing this and bring the jaw forward as you do that. So we use Class 2 Division elastics, and also occipital headgear, which I'll show you here in a little bit. This is the upper arch just stretched out like that, and the lower arch, and we didn't have any wisdom teeth in this particular case. The older I get, the worse my voice gets. So you'll have to put up. We'll try to do as good as we can, and hope you can understand what we're doing. Now we use these small brackets. These are just single brackets glued on without the wings. I would recommend, if you're starting out of this, use those wings, as long as you put the sealant all over the tooth. If you don't get the brush underneath the wings, it won't cause decalcification. The sealant will last pretty much the whole time you have the braces on, as long as you're not brushing it. Now we put our Class 2 hook on here out of about a 12,000 soft stainless steel, and this is a 10,000. Here we lace these teeth together so we can just have them united in one chunk, and we pull over here. It'll pull just as much, and you wear Class 2 elastics off like that. And these are just little tiny brackets, but if you got a tooth rotated in this way, you move the bracket slightly over that direction. Don't get it too far, and then when you straighten it up, it'll pull the wire down into the bracket better, and rotates the tooth. I'm going to show you 2 or 3 pictures. I've got one crazy picture, got it up and down, but it shows you some idea about this. Now these little brackets have a tip in them, and you see we bonded that one on maybe a little bit too much tip, and so the tooth is kind of headed in this direction. The centrals, all of them are going to be where the teeth are tilted to the distal, especially the cuspids in here. And if you ever widen out the cuspids, make sure you carry the root back with the crown. See, when you go, if you widen it out like that. Now that's the bracket that we, the ladies that worked in the office and everything, they prefer this bracket. And so I have used them for many, many of the cases that we use, and we tried other brackets, but I never have had anything that worked any better than just these little simple brackets. And if you're just starting out, it's better to have these with the wing sticking out so you can rotate the teeth a lot easier than you can with these. Now this, if it's badly rotated, we slip a wedge under one side and pushes the tooth down that way. All right, let's get on with this. We're going to open the bite now. So we'll, let me get in here and show you some of the arch wires we use. And we put the class 2 elastics. We're going to be coming off like that in there as far as pulling it to. Plus we use a head here. Now this slide here is this upside down, but you get a good idea. Look at how these rectangular wire fits into those brackets. Now that's a 17-2-5 wire in a 018 bracket. So you got a 1/1000th clearance in here going in, and that affects the amount of torque that you get out of these brackets. But you have a greater space in here. You can bend the wire more, so that's we like those small brackets better than any that we tried to use. And so anyway, got that in there. You get an idea looking at them from the side or the top. And this is a bad picture of the little girl. I've got another one here too. In fact, all three of those are bad. This is 4/28/11, and here you're starting off the picture. You see the two front teeth sticking out above the lip right here. We're going to go back and go through this whole thing now. We've got a lot of slides, and you see how the chin is dropped way back here, and you really want the chin out, something like that. Now I think we brought the chin out maybe further than we needed. This is how we've seen this picture before. That's how she bit into the tissue. The lower anterior teeth actually closed into the tissue as she closed her teeth together. And that gets it irritated, but as long as they don't do it all of a sudden, you'll have a little place in your gum tissue back there where the teeth fit. And we're going to start pulling this back in, but this is just to view it before we actually started working on it. And this is 6/23/11, and okay, we put the brackets on it. I've got an intruding wire. You see this wire coming in here, and it comes off of the side. This particular wire is piggybacked on top of the starting wire. You can put it on any part of this the day you start the case. See, and this wire would go down like this, and you'd bring it up, hook it to these teeth, so it'll be pushing them down. As you try to advance the lower teeth, you gotta kind of separate them from the upper teeth, and as you advance them, they'll close back in here behind with a proper overbite and overjet in here. Now, uh, let's go on. You can see we use an elastic chain to pull back on this to close this space. Keep that going, and we'll be pulling these teeth forward on the bottom down here, and we'll put some class 2 elastics up here in just a little bit. All right, that's the lower teeth, and we're pulling the molars forward a little bit there. Now, this is a occipital headgear, and it has a bow that goes from one side to the other, and the way you would tell where you ought to raise the front teeth, and we use it in class 2 elastics. We're pulling down on the front teeth, so we put this occipital headgear on. Let me get another picture of it here. That's 7/21 of 11. Let me get to that. We've got some pictures of that x-ray showing it better, but this gives you a good view of the intruding arch. See, we got a double bracket in here. And this wire, you put it on with the other wire when you start the case, and you can start leveling the case the day you started with this. Now that's the upper, the cement. This was before she got her 12-year molar. See, they're not even in yet, and we have a little space in this deal. We're going to line these cusps up as best we can, starting in like that, and working that over the lower arch. And there's the lower arch before the second molars came through. And this is 8/25 of 11, so we're moving forward. Now here we've got the class 2 elastics pulling in this direction. Now the class 2 elastics, if it's closed down like that, you have a certain vertical force along with a horizontal force back here. And to counteract the lowering of these, we use the headgear, which also pushes this area back up here while we bring the lower arch forward to correct that. There's the class 2 elastic, and you've got a vertical component in the class 2 elastic, and it's pulling down up here, picking this up back in here. So we'll actually put something on there to keep this from coming down, and we'll bring this up and level and bring it. The intruding wires brought this already down there. Now that's got the intruding wires taking these teeth out from around the gum line where they were biting into the gum tissue up above. And this is another view. These pictures are kind of confusing, and I hope you will understand what we're doing here. The little brackets that we've put on here have a vertical slot. You can see it here, and you can put hooks and things like that in those slots. Now here, excuse me, this occipital headgear, it's got a little tongue right here. I want you to see that so that you know that part you put between the front teeth up here, and then you make your bow short if you wanted to pick it up out here, or you lengthen it further and you can have it pick up more in the back, or just pick up anywhere along the way in there. Now, I don't know what prompted this young lady to roll her eyes over to the side like that, but she did. And she's still got them rolled over. Then you can, don't know whether I've got a good view of that little tongue that goes under the arch wire. So you're actually picking these teeth up in the front part of the mouth. Now when you pull with it from here, you see, if you cut these bars shorter, excuse me, you can pick up just the front teeth, or you put it about midway and it'll pick the whole thing up, or you can go back further with a hook and it'll pick the back teeth up, so you can pick it up like that or like this, or you can go up this way with it. This is a very useful tool in orthodontics, and people run around saying, well, I never use a headgear. Well, you just miss out on something that's a good force in the arch wire. And you take somebody that's really looking bad, they'll wear headgears. And as they get to looking good, they kind of slack off on it, though. But that's the occipital headgear. And let me erase that, and you can see that pretty good. I don't see the little tongue part that fits under the arch wire there. It may show it. No, I don't think it do. But we've leveled this out. In other words, we brought these teeth down and we brought them forward, brought these up and brought them back a little bit and closed the space up there. And that's still not back far enough. And we'll continue with it. And you had to widen the arch out some, but we've got the upper one wider than the lower, else she's biting to the side. So we'll have to widen this out so that the cusp of the upper teeth fit over the cusp of the lower teeth right in here. Now the arches are widened out. Now we're 12, 22 of 11. So we're still in 11. Now we've done to class 2 pretty well out, and we got a little more torque on them than we really need to have there. There's a good view of the little brackets now, the slot that goes through the bracket. You can put pins or anything in those slots like that. And this is the models back 42811, and this is the way the models were, 42811, and that's the Overjet that we had, and that's about as bad as I've ever gotten hold of to do without any surgery or anything. So down here is 6, 12, and we've got the teeth up to this point here, and we've taken the braces off, and we're just about finished with the case. And this is fitting in, the cuspids coming right down in bicuspids. And if you leave it alone and hold it, and she wears a retainer, just the biting force here will glide these teeth down. And the young lady is still there. In other words, she left her retainer out, I think, and has lost a little bit of this, but nothing like it was to start with. She's grown and married now, and here's the 12-year molars in on the bottom, you see, back here, and everything fitting in line. I say bottom, this is the top, I'm sorry, and the top and her lower teeth used to fit up in the roof of the mouth back in here somewhere. Well, now they're fitting more like they should. And the tongue's right in here. We've bonded a 3-to-3 retainer on, and we've got it really bonded on there. It's all the way around. And this is the finished thing. And this, we'll run through the x-rays here a little bit. This is pretty much after these are not very good. Showing they're biting on a little wedge out there. I don't like that to show the orthodontics. We bite with the teeth together better. And so anyway, we go through that. Here is the finished thing, and she's biting together with the retainer in the mouth. And this is the smile, and you see where the chin is now, and you saw where it was back when we started back here. And that's the kind of the finished position of the facial structure. And you remember when we started, the chin was somewhere back like that. So Anyway, this is her finish. This was where her teeth was fitting when we started out. So this is you change the whole person's life. If you leave them alone like this, they'll end up with their 40, 50, 60, or 70 if they still got the teeth. They'll be biting up in here, these teeth will be way out here in front. And usually they move because they're not hitting properly. They're actually in front of the lip when you start off. So thank you for watching, and I hope you get something out of this. You can move this out. Now you don't make the jaw grow, but you reposition the jaw. I'm sorry to pull that thing out of there. So I'm going to hang up here and say thank you for watching, and I'll close up, and I hope you will join our group and subscribe to it. And I'm going to move over here and stop the deal.